Hey, welcome to our explainer. Today, we're diving into something we all create every single day, but probably don't think twice about once it's out of sight, and that's our trash. We're going to peel back the curtain and see how that overflowing bin on the corner isn't just ugly, it's actually the first step in a chain reaction of disease that can lead right back to us.
So let's just jump right in with the big question. When you see garbage just dumped somewhere it shouldn't be, what's the first thing that comes to mind? Probably the smell, right? Or just how messy it looks? And yeah, you're not wrong. But what if I told you the real danger is completely invisible? That it's not what we see or smell, but the diseases that are allowed to spread.
You see, the answer here is so much bigger than just pollution. When we don't manage waste correctly, we're creating a direct, serious threat to public health. It's like opening up a secret highway for diseases to march right into our communities.
Okay, so how does that even happen? How does a simple pile of garbage morph into a full-blown public health crisis? Well, in this first part, we're going to trace that exact pathway, step by step, from a piece of trash to the actual transmission of disease. Now, to really get a grip on this, there are two key ideas we have to understand. First up, disease vectors. Think of these as the carriers, the little critters, the insects and animals that shuttle germs around. And second, pathways. That's just the route they take to bring those germs from the garbage pile to us.
And here's how it all plays out. It's a simple four-step process. Step 1, waste gets dumped improperly. Step 2, that trash becomes an all-you-can-eat buffet and a 5-star hotel for vermin. Step 3, those vermin, our vectors, pick up all sorts of nasty pathogens. And the final step, step 4, humans get sick, a lot of the time without ever knowing it all started in a nearby trash heap.
All right, now that we know the how, let's meet the who. It's time to meet the culprits themselves. We're about to shine a spotlight on the specific disease vectors that absolutely thrive in our garbage, turning it from a nuisance into a genuine health hazard. And we'll start with one we all know, the common housefly. We usually just think of them as annoying, right? Something to swat away. But these little guys are incredibly effective vectors for some really serious diseases. We're talking typhoid, salmonellosis, and dysentery. So when a fly lands on your food, it might have just come from a garbage pile. And it's not just being annoying, it could be dropping off some very dangerous passengers.
And here's the thing, our food waste is the perfect incubator for them. They lay their eggs right in that warm, decomposing garbage. The larvae hatch, they feast on it, and then boom, new adult flies pop out, ready to go. And get this, they can fly up to 10 kilometers away. That is a massive contamination zone, all starting from a single pile of trash.
But it's not just the food in our trash that's the problem. Our next vector, the mosquito, is more interested in the containers we throw out. We all know mosquitoes are responsible for horrible diseases like malaria and dengue fever, and it turns out our discarded junk is a huge help to them. See, mosquitoes need stagnant water to breed, just a little bit of it, and our trash is full of perfect little pools for them. Every single discarded can, old tire, even a crumpled plastic bag can collect just enough rainwater to become a thriving mosquito nursery. Now, what's interesting is that some of these vectors don't even have to bite us to be dangerous. All they need is access. Take roaches. They can spread diseases like cholera and typhoid just by physical contact, literally carrying the pathogens on their bodies as they crawl from a garbage bin straight into our homes. And the link here is just crystal clear. The whole roach problem is tied directly to how we store our garbage. A bin that doesn't seal right or a simple rip in a trash bag is basically a welcome mat, giving them everything they need to eat, hide, and multiply. Okay, let's move on to one of the most notorious vectors of all, rodents. Rats especially thrive wherever waste is out of control, and they carry a frankly terrifying list of diseases. Plague, leptospirosis, rat bite fever, the list goes on. For a rat, an uncontrolled garbage dump is paradise. It's an endless buffet and a safe place to call home. But here's the kicker. It's not just the rats themselves we need to worry about. The fleas that live on them are a whole other problem, carrying their own set of diseases. It's a threat on top of a threat. So the chain of transmission doesn't always stop with pests. It can actually include animals that are fed our waste. For example, if pigs eat raw, contaminated garbage, they can get infected with parasites that cause diseases like trichinosis and toxoplasmosis.
And that disease then makes its way to humans when they eat infected pork that's either raw or hasn't been cooked properly. This points to a really clear, really critical way to stop this. Any solid waste that's used for animal feed has to be cooked thoroughly to kill off these dangerous parasites.
So far, we've really been focused on the indirect threats, right? How these vectors carry diseases from our trash out into the general public. But for the people who handle our garbage every single day, the dangers are much more direct, much more immediate. So let's talk about the occupational hazards they face. Waste handlers are dealing with a constant stream of physical risks. You've got sharp edges from broken glass or metal hiding in trash bags that can cause serious cuts. But the scarier risks are the ones you can't see. A puncture wound from a discarded needle isn't just a small injury. It can be a way to transmit life-altering infections like tetanus, hepatitis, or even HIV. And because these risks are so severe, taking precautions isn't just a good idea, it's an absolute necessity. Proper protective gear, gloves, masks, and, critically, vaccinations are the absolute baseline required to keep these essential workers safe. So let's wrap this all up. When you look at all the evidence, it's just undeniable. Whether it's a fly breeding in old food or the very real physical dangers that sanitation workers face, unmanaged waste opens up a direct pathway for disease to walk right into our lives. It's a massive and honestly an often overlooked public health problem. Which leaves us with one final and I think really important question to think about. Now that we know about all these hidden dangers, how might we rethink our relationship with the stuff we throw away? Because as we've seen, what we discard doesn't just vanish. It has a real, tangible impact on the health of everyone around us. Thanks so much for joining us.